So one patient I remember very clearly was somebody who was a middle-aged gentleman who was very healthy, and he never thought that he would ever have a heart attack or be diagnosed with heart disease. In fact, he was a runner and practiced on a regular basis. And one day, while he was on his run, unfortunately, he suffered what we call sudden cardiac death, which results from a major heart attack that can lead to very dangerous heart rhythm, which in turn is incompatible with life. He was very fortunate that he was in an area where there was another gentleman who was able to provide CPR and do the initial resuscitation and call EMS. Once this patient arrived at our doors, it was a life and a death matter, and it was a true emergency because he was having a massive heart attack. Fortunately, myself and my entire team in the cardiac catheterization lab were alerted beforehand from the ambulance services. So we already came into the hospital and we were ready to deal with whatever needed to be done. As soon as he arrived at our hospital, we took him immediately to the cardiac catheterization lab without wasting a single moment. We were able to gain access into his body and go up to his heart arteries, and within few minutes we were able to identify the artery that was completely blocked and causing a major cessation of blood flow to his heart muscle. At that time, his heart muscle was dying, and that's why his heart was fibrillating. So we worked very quickly and used the techniques and tools that we have to gain access into the artery, and we were able to perform balloon angioplasty followed by a stent placement, and then we were able to resume the flow of blood to his heart muscle, hence stopping the heart attack in its tracks and preventing any more damage from being done. One of the things that was very satisfying was that he immediately got better as far as his heart rhythm improved, his chest pain improved, his vital signs improved. So this happened several years ago, and to me, one of the most satisfying part of my job is to be able to see these patients over and over again as time goes on. So I've been seeing him for several years now, and I've been able to work with him as far as getting him through not only the initial diagnosis, but also trying to keep him healthy as he goes forward. So we have worked on diet and exercise and general lifestyle modifications, because at this time my goal is to prevent another heart attack from happening. And it's just been very, very satisfying to be able to not be there when he needed me the most, but then continue to follow him and have that patient really as a true friend as time goes on.